Bed making is a skill that every nurse should know. The purpose of bed making is to help clients feel comfortable and to decrease pathogens in the client's environment. Clean, dry, and wrinkle-free linens also help to reduce the potential for skin breakdown, and they are important to help control odor. Here are the practice guidelines for bed making. Number 1. Wear gloves while handling a client's used bed linen. Linens and equipment that have been soiled with secretions and accretion harbor microorganisms that can be transmitted to others directly or by the nurse's hands or uniform. Wash hands after removing gloves. Number 2. Hold soiled linen away from uniform. Number 3. Linen for one client is never placed on another's client's bed. Number 4. Place soiled linen directly in a portable linen hamper or tuck into a pillowcase at the end of the bed before it is gathered up for disposal. Number 5. Do not shake soiled linen in the air because shaking can disseminate secretions and excretions in the microorganism they contain. Number 6. When stripping and making a bed, conserve time and energy by stripping and making up one side as much as possible before working at the other side. And lastly, to avoid unnecessary trips to the linen supply area, gather all linen before starting to strip a bed. Changing an unoccupied bed. Purposes of changing an unoccupied bed are the following. Number 1. To promote the client's comfort. It will also help provide a clean, neat environment for the client. And lastly, it will also provide a smooth, wrinkle-free bed foundation, thus minimizing the source of skin irritation. Now for assessment, before doing bed making, we have to make sure to assess the following. Client health status to determine that the client can safely get out of bed. In some hospitals, it is necessary to have a written order to get out of bed if the client has been in bed continuously. Client's blood pressure, pulse, and respiration if indicated. The rationale for this is because client may experience orthostatic hypotension when moved from a lying position to sitting to standing, particularly if it is the first time for them to get out of bed for a while. Client's mobility status. Rationale for this is because this may influence the need for additional assistance with transferring the client from the bed to a chair. And lastly, tubes and equipment connected to the client. Because the rationale for this may influence the need for additional linens or waterproof pads. Bed making is usually assigned to an assistant practitioner. If appropriate, inform the AP of the proper disposal method of linens that contain drainage. Ask the AP to inform you immediately if any tubes or dressing become dislodged or removed. Stress the importance of the call light being readily available while the client is out of bed. Equipment needed. Clean gloves if needed. 2 flat sheets or 1 fitted and 1 flat sheet. Cloth draw sheet, optional. 1 blanket, 1 bedspread. Incontinent pads, optional. Pillowcases for the head pillows. Plastic laundry bag or portable linen hamper if available. Now moving on to implementation. For the preparation, determine what linens the client may already have in the room. Rationale for this is to avoid accumulation of unnecessary extra linens. For the performance, number 1, if the client is in bed prior to performing the procedure, introduce yourself and verify the client's identity using agency protocol. Explain to the client what you are going to do and why is it necessary and how to participate. Perform hand hygiene and observe other appropriate infection control procedures. Apply the bottom sheet and draw sheet, but this is optional. If using a flat sheet, place the folded bottom sheet with its center fold on the center of the bed. Make sure the sheet is ham side down for a smooth foundation. Spread the sheet out over the mattress and allow a sufficient amount of sheet at the top to tuck under the mattress. The rationale for this is because the top of the sheet needs to be well tucked under to remain securely in place, especially when the head of the bed is elevated. If using a fitted sheet, pull sheet over ends of mattress. Place the flat sheet along the edge of the mattress at the foot of the bed and do not tuck it unless it is contour or fitted sheet. Milter the sheet at the top corner of the near side and tuck the sheet under the mattress, working from the head of the bed to the foot. If a draw sheet is used, place it over the bottom sheet so that the center fold is at the center line of the bed and the top and bottom edges extend from the middle of the client's back would be the bed to the area where the mid-thigh or knee would be. Secure the bottom linens. Tuck in the bottom sheet under the head of the mattress, pull the sheet firmly and meter the corner of the sheet. Pull the remainder of the sheet firmly so that there are no wrinkles. The rationale for this is because wrinkles can cause discomfort for the client and breakdown of skin. Tuck the sheet in at the side and tuck in the drawer sheet, if appropriate. Apply the top sheet, blanket, and spread. Place the top sheet hem side up on the bed so that its center fold is at the center of the bed and that the top edge is even with the top edge of the mattress. Unfold the sheet over the bed. Follow the same procedure for the blanket and the spread, but place the top edges about 15 cm or 6 inches from the head of the bed to allow a cuff of sheet to be folded over them. Tuck in the sheet blanket and spread at the foot of the bed, and meter the corner using all 3 layers of linen. Leave the side of the top sheet, blanket, and spread hangingly freely. Loosen the top covers around the foot of the bed to provide space for the client's feet. Fold the top of the top sheet down over the spread, providing a cuff. The rationale for this is because a cuff on the sheet makes it easier for the client to pull the covers up. Move to the other side of the bed and secure the top bedding in the same manner. Put clean pillowcases on the pillows as required. Grasp the closed end of the pillowcase at the center with one hand. Gather up the sides of the pillowcase, place them over the hand grasping the case. Then grasp the center of one short of the pillow through the pillowcase. With a free hand, pull the pillowcase over the pillow. Adjust the pillowcase so that the pillow fits into the corners of the case and the seams are straight. The rationale for this is because a smoothly fitting pillowcase is more comfortable than the wrinkled one. Place the pillows appropriately at the head of the bed.
Let's proceed to changing an occupied bed. The purposes are to conserve the client's energy, to promote client comfort, to provide a clean, neat environment for the client, and to provide a smooth, wrinkle-free bed foundation, thus minimizing sources of skin irritation. For the assessment phase, assess skin condition and need for a special mattress, footboard, or heel protectors. Assess client's ability to reposition self. This will determine if additional assistance is needed. Determine presence of incontinence or excessive drainage from other sources indicating the need for protective waterproof pads, and note specific orders or precautions for moving and positioning the client. The equipments to be needed are 2 flat sheets or 1 fitted and 1 flat sheet, cloth draw sheet, this is optional, 1 blanket, 1 bedspread, incontinent pads, this is also optional, pillowcase for the head pillow, plastic laundry bag or portable linen hamper if available. For the implementation, determine what linens the client may already have in the room. This avoids hoarding of unnecessary extra linens. First, prior to performing the procedure, introduce self and verify the client's identity using agency protocol. Explain to the client what you are going to do, why it is necessary, and how to participate. Perform hand hygiene and observe other appropriate infection control procedures. Apply clean gloves if linen is soiled with body fluids. provide for client privacy. Remove the top bedding. Remove any equipment attached to the bed linen, such as a signal light. Loosen all top linen at the foot of the bed and remove the spread and the blanket. Leave the top sheet over the client or replace it with a bath blanket as follows. Spread the bath blanket over the top sheet. Ask the client to hold the top edge of the blanket. Reaching under the blanket from the side, grasp the top edge of the sheet and roll it down to the foot of the bed, leaving the blanket in place. Remove the sheet from the bed and place it in the soiled linen hamper. Switch the bottom sheet and the draw sheet. Raise the side rail that the client will turn toward. This protects clients from falling and allows them to support themselves in the side-lying position. If there is no side rail, have another nurse support the client at the edge of the bed. Loosen the bottom linens on the side of the bed near the nurse. Fan-fold the dirty linen toward the center of the bed as close to and under the client as possible. This leaves the near half of the bed free to be changed. Place the new bottom sheet on the bed and vertically fan-fold the half to be used on the far side of the bed as close to the client as possible. Tuck the sheet under the near half of the bed and miter the corner if a contour sheet is not being used. Place the new bottom sheet on the bed and vertically fan-fold the half to be used on the far side of the bed as close to the client as possible. Tuck the sheet under the near half of the bed and miter the corner if a contour sheet is not being used. Place the clean draw sheet on the bed with the center fold at the center of the bed. Fan-fold the uppermost half vertically at the center of the bed and tuck the near side edge under the side of the mattress. Assist the client to roll over toward you over the fan-folded bed linens at the center of the bed onto the clean side of the bed. Move to the other side of the bed and lower the side rail. Remove the used linen and place it in the portable hamper. Fold the draw sheet fan-fold at the center of the bed and pull it tightly with both hands. Pull the sheet in 3 divisions. Face the side of the bed to pull the middle division. Face the far top corner to pull the bottom division, and face the far bottom corner to pull the top division. Tuck the excess draw sheet under the side of the mattress. if a contour sheet is not being used. Place the clean draw sheet on the bed with the center fold at the center of the bed. Fan fold the uppermost half vertically at the center of the bed and tuck the near side edge under the side of the mattress. Assist the client to roll over toward you over the fan-folded bed linens at the center of the bed onto the clean side of the bed. Move to the other side of the bed and lower the side rail. Remove the used linen and place it in the portable hamper. Fold the draw sheet fan fold at the center of the bed and pull it tightly with both hands. Pull the sheet in 3 divisions. Face the side of the bed to pull the middle division. Face the far top corner to pull the bottom division, and face the far bottom corner to pull the top division. Tuck the excess draw sheet under the side of the mattress. Reposition the client in the center of the bed. Reposition the pillows at the center of the bed. Apply or complete the top bedding. Spread the top sheet over the client and either ask the client to hold the top edge of the sheet or tuck it under the shoulders. The sheet should remain over the client when the bath blanket or used sheet is removed. Complete the top of the bed. Ensure continued safety of the client. Raise the side rails. Place the bed in the low position before leaving the bedside. Attach the call light to the bed linen within the client's reach. Put items used by the client within easy reach. Document. Many agencies use a checklist that indicates if bed linens were changed. For the evaluation, conduct appropriate follow-up such as determining clients' comfort and safety, patency of all drainage tubes, and clients' access to call light to summon help when needed. Recess all tubing, oxygen apparatus, IV pumps, and so forth. This prevents error in supportive devices resulting from procedure.